All right, here's where we are going. Shh. Come back to me. This would be an interesting drinking game. How many times does Mr. Hess say, "Come back to me," or "Are you with me?" in what a single class period? Huh? Yeah. All right. I'm talking about drinking water. What are you talking about drinking? Wow. All right, so this is our study guide for chapter 19. Yesterday we spent most of our time on the anatomy. Do a brief recall, because we covered just about every piece on this study guide. And this is, of course, one you need to know. It's on that list, on that study guide. This is chapter 19. Everyone got a page for me there? Page 507. Thank you, Kaylee. Page 507. If we were to talk about the journey of a sperm, that's one of the questions that are on your study guide. It's easy to use the anatomy to talk about that journey, right? Where is a sperm created? A spermatogenesis is what we call it. It's created where? In the testes, right? So this is a little cross-section picture of what it looks like. You can see all the little tubes, the seminiferous tubules that are all coiled up inside that testes. And then if you were to take one of those tubes and slice it, that little plane there, this is what you would see, that these cells start as regular cells and gradually become sperm. That's that process that we call spermatogenesis. So, starting in the testes, they are then released into the epididymis. That is, that tube is kind of curled up on top of the testes. Down that epididymis into the vas deferens, ductus deferens. Either one is acceptable. And that's the tube that runs from that testy all the way around the bladder, hooks up with the prostate gland there. Prostate gland is producing that milky white fluid that has what purpose? Do you remember?
The alkaline.
The alkaline, right, to neutralize the acidity of the sperm themselves, as well as in the environment of the vagina once the sperm gets there. So it meets with that, coming from the vas deferens into the urethra, which is that tube going from the bladder and out. Same tube, two functions, right? Passes along past the bulbourethral gland, passing down through the urethra. The urethra runs through which part of the penis? It runs through the corpus spongiosum, not the part that is being filled with blood, the corpus cavernosum, right? The spongiosum is more that spongy, flexible material, tissue. And then out the urethra. Out it goes. Come on, CJ. Okay. Any questions anatomy-wise? Oh, I have a question for you, actually, but see if you have any questions for me. Any questions anatomy-wise? We talked yesterday about circumcision. And I did some looking up yesterday to see what the statistics were. And truthfully, we don't know. There's been like a number of different statistics or studies that have been done, samplings over the last, let's say, 4 or 5 years. And each of them gives slightly different answers. What I can say is it's somewhere between 20% and 80%. Doesn't really give you much information, does it? All the studies are showing, though, that the numbers are decreasing. A number of the studies seem to hover around 60% being circumcised versus not being circumcised. In the United States, those numbers vary significantly. Other places, other countries. Wikipedia, truthfully, has a very nice article talking about the different countries and their prevalence of circumcision versus uncircumcision. Your Muslim countries, as a matter of fact, are the most circumcised. Because, of course, Abraham, right? They are very strong believers in Abraham, so it would make sense that they would continue on with that tradition of circumcision. Questions that you have for me? No questions?
I'll give him a question.
Please.
We tell a joke.
Jokes now. Questions are good, though.
It's an AMP joke.
It's an AMP-related joke. I'm afraid, Hannah, and that makes me even more scared. All right, hit me. Go with it.
No. We told He told Boyer, he didn't care.
No.
I see. All right, give it to me.
Tommy, come on.
How much does a Jewish doctor charge for a circumcision?
How much does a Jewish doctor?
Just a doctor.
Oh, okay. What?
Nothing. He just keeps the tips.
Very nice. Very nice. Very nice. All right, moving on quickly. That's good. Who else am I missing today? Kim. Sandhya. Trying to sneak out on me. All right. Here's my question to you. Anatomically, remember we said that the testes and the ovaries are the same tissue, basically, right? Start off as the same tissue. But ovaries are inside the body. Testes are outside the body. I ask you, why?
I'm guessing there's some.
There truthfully is some reason. It's not just about decoration. It's a good question, isn't it? It's a good health benefits. I think most guys would say there's not much health benefit to it if you get hit there.
True.
Think about it now. Let's use your critical thinking.
Maybe because the egg or something with the baby being.
Maybe about the fertilization.
I know.
What's that? A warm enclosed area. Okay. What if I told you it does have to do something about temperature? But this is outside the body versus inside the body. Which is warmer?
Maybe they died inside is warmer.
Inside is warmer. You said what? They do. They need a temperature to be formed that's lower than your body temperature. Truthfully. So therefore, that is why they are on the exterior of the body, to keep them cooler. Truthfully. And I know you're going to chuckle, but I'll tell you this is truth. You realize that some men have what they call a low sperm count, right? They have a hard time, they don't conceive, but helping their wives conceive, because they don't have enough, the sperm is not healthy enough, or not active enough, or not enough, not many enough. One of the reasons can be because they are wearing underwear that holds the scrotum, the testes, too close to the body. I kid you not. And they will say, or like a tighty whitey, sure. And they would say, no, okay, you need to switch underwear to allow those temperatures to decrease, to allow the increase in the sperm. No, I'm not saying that. I'm saying for some guys that's how it works. Yeah. Yes.
Guys aren't supposed to stay in hot tubs.
Hot tubs are more that it's more just you're raising the core of your body temperature. And the same thing with women. So it's not necessarily going to, I suppose it would have some effect on the sperm production, but more important is your core temperature. Because you have a very narrow range that we can stay as far as temperature goes.
If you have sex in a hot tub,
Are you more like... the mechanics of that are pretty difficult. But, yeah, Glee, right. No.
They talk about it on Glee, and I've been wondering
They do. Right. Right, the question was asked, is it possible to get pregnant through a hot tub? In other words, that there's not actual...
Oh, no. I was asking, are you less likely, if you are actually having sex in a hot tub, are you less likely to get pregnant because it's hotter?
I wouldn't think so. No, I wouldn't think so. Because those sperm have already been produced. You with me? Yeah. Sure. You would truthfully have more difficulties from... it actually would probably be more dangerous for the woman, because it would be easier to have some of that water from the hot tub up into the vagina. That's what I would say would be more difficult. Yeah. I mean, not burning per se, but I'm talking more about bacteria and that kind of thing. Yes. Depending on, I guess, how hot your hot tub is. But yeah, no. That shouldn't be too much of a problem. But. Good. Yeah. There are, especially as you are younger, one of the one of the tests that the physicians will do would be to check the scrotum, of course being the covering, the skin covering over the testes, to see if both of those testes have descended. Have you heard this term before? That this means, because again, the testes start off inside the body, just like the ovaries. And as you are developing, and before you are born, they move into the outside. If they are not, obviously that testes would not be able to produce sperm, because it's too hot, right? So there is surgery they can do, they can move it down. Sometimes folks just don't have it. Maybe they were born in a place that didn't have good medical care, or there's a number of reasons. So they may only have one testicle that descended, or even no testicles that descended, depending upon.
So if you have no testicles that descend, does that mean you have ovaries?
No, because they're functioning still as testicles, but I would think that your ability to produce a sperm would be significantly limited. Doesn't mean that you're a girl. It just means they're not functioning the way they should.
Can you produce sperm with only one testicle?
Sure. Oh, yeah. Absolutely.
Like,
Yeah, I watched this.
I don't think too much, no. But,
I watched this I forgot, it was one of those weird TLC shows.
okay.
And so this guy, he was already homosexual.
Mm-hmm.
So he just wanted to donate one for the money.
Okay.
He had a hobby of donating stuff about his body just for the money.
Okay.
And the guy said that they couldn't because it apparently what is it? Is it that? It might be something like that. It was something weird like that. But the doctor said he couldn't because he already had too low of testosterone.
Gotcha.
That if you take one of those out, you would really lower your testosterone.
Definitely. So it's going to affect you hormonally, because that's one of the things that the testes produce, right? But it's not going to necessarily affect your significantly. You will still be able to produce sperm. Sir.
so what happens if he had donated it and his testosterone dropped really low, and all he had was estrogen?
Well, I mean, again, hormones are not the only thing that make you male or female. We talked about this yesterday, that it's a very complicated thing. But you would certainly have developed some of these other characteristics, sure. Yeah.
Why would it matter?
What's the importance of what?
Testosterone.
Oh, testosterone. Well, let's talk about that. It's in your textbook here. We talk about the secondary sexual characteristics. Where is this at? There we go. It's on page 513. Testosterone. Okay. 513. Actions of testosterone is actually on page 515. Take a look. You can see that list. Talk to me. Tell me about some of the things that testosterone does.
We on page what?
515. There's a nice list of them. What's it got there? So increased body hair growth. Because again, this is what puberty is, right? That you're hitting this increase in these testosterone hormones for guys. So increased body hair, what else? These are secondary sexual characteristics.
Thickening of the skin.
Thickening of the skin, okay, the larynx, so that's why your voice becomes deeper, right, as you go through puberty. What else? Bone strengthening. What else?
Muscular growth.
Muscles, right, that's what athletes, that's why they take corticosteroids, these fake or synthetic hormones to get more muscle. What else?
Narrowing of the waist, broadening of the shoulders.
Sure, narrow waist, broad shoulders, hopefully that's the case. What else? Is that it?
Increases rate of cellular metabolism and red blood cell production.
Sure. So these are all kind of the result of this increase in testosterone. They call them secondary sex characteristics because the primary sex characteristic is that puberty means you can now produce sperm. Are you with me? Up until that point, you are not doing this. Same thing with the ladies. You have all of your eggs that are with you from the start, from the moment you are born, all your eggs are present. You don't have to create any more of them. But it's only at puberty that you start releasing them on this monthly cycle. And that is your primary sex characteristic. Does that make sense? And the secondary sex characteristics are all the other things you think about with puberty. Yes, ma'am?
Wait, so you can't make more?
You cannot. No. So if they're damaged, then you're toast as far as that goes. I'm sorry? one egg. One of these eggs.
Just like the average woman have that.
I'm sorry?
How much do like the average woman have?
Oh, that's a great question. I don't know the number. I mean,
It really isn't like a lot.
sure. It would be certainly, I would think in the thousands, but I don't know a number. It's a good question.
Wait, so let's say it was 1,000.
Yeah, that sounds about right. I mean, think about it, one a month for, let's say, 40, 50 years.
I'll have like kids at 30.
Sure, yeah. All right.
What makes you like infertile? Like is this like the ovary not like releasing correctly?
There's lots of things that make you infertile or not. We'll talk about more of women there. For the guys, infertility would be basically you aren't producing enough sperm. Maybe the sperm aren't healthy enough, like they're not mobile enough. Because, we'll talk about this, but realize that just the act of sexual intercourse is just the first step to being pregnant, right? That sperm still has to travel all the way up the vagina, through the cervix, into the uterus, up the uterus, into the fallopian tube to meet that egg. And if all of that doesn't happen, you're not getting pregnant. It can be a day or two sometimes, just depends. And then from there, and we'll talk through this whole process. We're getting ahead of ourselves. But then the egg still even has to implant in the uterus for you to actually become pregnant. More often than not, that egg does not implant. And you flush it out. And you don't even know that you were pregnant, in quotes. This is just a microscopic slide of the cross-section like this of the testes, that one seminiferous tubule. So you can see the actual sperm are here, and these are the cells that are in the process of making those sperm. Here is not an actual picture, but a diagram of the one of one sperm in itself. Stay with me. 4 big pieces. You have the head, the mid piece, and the tail. And the head you can break into 2. The acrosome and the nucleus. The acrosome is kind of like a helmet on top of the head, which is the nucleus, right? On top of that nucleus. What do you think that acrosome might be for? Protection, okay, from all the things trying to beat it. I don't know what beating the sperm, but in some ways it is protection, though. Protection from what? I didn't hear. Did someone?
I said it's for puncturing.
Puncturing what? The egg, sure. So it is part of the protecting the sperm from that, again, harsh environment of the vagina. I know you all chuckle when I say that, but it truthfully is. It's not a place where things are supposed to be living. Are you with me? On purpose. On purpose. But it's also to provide the mechanism for that sperm to dig into the ovary. Not the ovary, the egg. The oocyte. So that's another one of the pieces that you were supposed to know. On your diagram, here's another look. Realizing, of course, that sperm are only containing 23 chromosomes, right? All the rest of our cells contain 46 chromosomes. But they go through this meiosis where they only have half of them. And that's because the sperm and the egg combine to make the 46, right? So the sperm and the egg each only have 23 chromosomes. Half of a person, right? And you mix it with the other half, and you get a baby. Yes, sir? Okay. Birthmark is just, remember melatonin? That's I want to say dye, but it's not dye. It's a pigment that's there with each, in the skin cells. That's just a concentration. A bunch of it's all in one place. All right. This is another kind of a look at that same process. These divisions to get you the sperm cells. The level of, this is talking about the hormones in the bloodstream from the pituitary gland, right? The pituitary gland is what controls that testy. Good. Any other questions as far as the male goes? Did we cover all the pieces here? So you could talk about the journey of the sperm, right? From the formation to the exit. Spermatogenesis, that's just the making of the sperm, right? Happens in the testicles. 23 chromosomes. The parts of the sperm and the functions, we talked about that. Testosterone. Erection, orgasm, ejaculation. We talked yesterday about erection. It's basically the blood flowing into that corpus cavernosum, right? Let's go back here. Into the tissues that have spaces, right? There is a muscle that contracts kind of along the base of the penis that keeps that blood from flowing back out. Flows in the arteries, but it can't flow back out the veins. And that's what we get at, that's what an erection is, this tissue expanding. The ejaculation is obviously the sperm from here, along with the prostate fluid, the seminal fluid, the bulbourethral fluid, that's that pre-lubrication that's on the tip usually, and you get this whole ejaculation. Orgasm is simply the muscle contractions that provide this ejaculation. Medical term. Any questions? It's like old hat for you guys. I was going to say, it's exactly right. Never is. Yeah. No more questions. You're comfortable. Understanding. You could answer the questions that are on the study guide. And truthfully, like we said yesterday, yeah, I mean, there is much less for us to talk about as far as the guys go. Let's move on. Very good. We are. Simple, easy to understand, right? Absolutely. All right, so this is over. Kayla, you're right on top. I appreciate it. 5:16. All right. That's good. This is 2, 3, 4. Interesting. All right. So, let's talk anatomy here. And again, I really dislike these sagittal cuts. I think it's very hard to understand what you're looking at with these. But these textbooks always try and draw balance between informative and pornography. Are you with me? So that's why you get these diagrams like this. We'll have some other pieces that we'll talk as we move on here. Okay? But this is a diagram you need to know, right? So the unique piece with the female versus the male is that you see that there are 2 exits, and I guess 3 if you want to count coming out the anus as well. So guys have 2, the ladies have 3. Because instead of there being the urethra carrying the sperm and the urine, in the woman it's separate, right? So the bladder is here in front. That's what this guy is here, with the urethra coming out there. And then posterior to that is where you have the vagina. I'm sorry? The urethra is the pathway from the bladder to the outside. Exactly. But remember that on the guy, it basically, they meet right here, right? That's the spot where the urethra, the bladder, the urine, and the semen, though it's really just a sperm at this point, meet up together.
Is there a reason why they don't just meet up on the girl?
I would say you have to take that up with the Creator. I'm not sure. I don't know. But there is definitely that difference. That is a significant difference between the two. Okay? You have this view here that labels the clitoris, which is on the most anterior portion, if we're looking at it from this front to back view, this anterior, posterior, anterior being on the left, posterior being on the right. It's the most anterior structure. You could also say it's the most superior, if you're looking at it from the front. And you notice that it's just a small little area that you see externally, but it does come up significantly. There's another slide I'll show you about that. That it's a much larger structure than you think it is, just because you can only see a tiny little bit of it externally. It's a much larger piece internally. The vagina, as it comes up, that's where you get the uterus. That here is kind of like sitting down on top of the bladder. Remember in our cats how significantly small the uterus was in the non-pregnant cats and how humongous it got with the pregnant cats, right? So this is tissue that goes through significant expansion in pregnancy. Attached onto those are the ovaries with those uterine tubes. And we'll talk more about that. You guys still with me? You've probably heard this term cervix, cervical cancer. Perhaps you've heard that. The cervix is just the opening to the uterus. So when you have a pap smear, what they are doing is they're going and they're scraping just a little bit of tissue from that cervix. And they're checking to make sure it's not cancerous. That's something that usually you have done once a year at your annual exam. When they talk about a woman being dilated for pregnancy, that's what they're talking about. That cervix goes from basically not even a centimeter in size. It stretches out to be 10 centimeters. And I'll have a picture that will show you that in the next one. It stretches significantly. Yes, sir?
When the baby's in the uterus, does
Yep.
that kind of contract the bladder?
Yes. There's no room. Yes, sir. Especially toward the end of pregnancy. So, I mean, you've got these ladies who have to go to the bathroom every hour because there's just not room. That baby is everywhere. You know? So, yes, absolutely it does. Any questions here? Okay. Externally, you get a view that looks like this. So this is now looking from that frontal view. Shh, stay with me. So again, two separate openings, right? The urethral opening and the vaginal opening, the anus being below, and then you see the clitoris on the top. The folds, that's what these labia basically just means folds, outer skin, right? That you have two pieces, the majora and the minora, that basically, again, this is an entrance to the body, so this is the body's way of protecting that entrance, right? Good. You can see, remember in the guys that we talked about some of those glands, the bulbourethral gland and the I'm missing my term. The bulbourethral gland and the seminal vesicle. Thank you. They thought for a long time that women did not have these things, but truthfully they do. They called the Skene's glands and the Bartholin's glands. These are the gynecologists who discovered these things. But they do actually produce the same kind of fluids. Shh, stay with me. The same kind of fluids that the males do. Not obviously in the same quantity, but they do produce those same kind of fluids for lubrication during intercourse. Questions? You're right. Very carefully. Very carefully. Stretches quite a bit. You've perhaps heard of the covering. The covering that covers the opening of the vagina called the hymen, right? And you can have multiple different ways of it working. Most of the time, it is just an open area after sexual activity. This is back in the day how they would determine whether or not you were a virgin, right? Because if you were a virgin, the first time you had sex, there would be blood, because you were literally, truthfully, tearing this little tissue. It's not very thick. It doesn't significantly hurt. There's a little bit of pain involved, I guess. But then there would be a drop or two of blood on your sheets, and they would know, yes, this woman was a virgin, and so all is good. But that's not the case. It's not always the case. It varies amongst women as far as how large the hymen is, whether there even is a hymen to begin with. Whether or not you've had sex is irrelevant. Some people wonder, well, if I use a tampon, because of course a tampon is inserted into the vagina, does that make me not a virgin? The definition of virginity you're using is completely wrong. You with me? To be a virgin means you have not had sexual intercourse. It has nothing to do with the hymen. Are you with me? On rare occasions, that hymen completely covers the vaginal opening. So this would be a problem because you really couldn't have a period, or there's a lot of things that would not be good about that. So that they would have to cut that, to open it, to allow normal functioning.
But how would you get like two or little dots?
Sure, again, it hasn't fully opened. Yeah, that's all. Yeah. Questions? Lots of good conversations going on. Bring them to me. I want to know what you're talking about. Are there questions? Are there comments? Yes, ma'am. No. Yes, please.
Okay, so let's say you're on your period.
Yep.
Use a tampon.
Yep.
And you break it.
You break
the little hymen. You wouldn't be able to tell them because it's.
Right, there's already bleeding that's occurring.
So I guess people that could happen.
Sure, absolutely. Doing just activities, just playing sports. Again, this is a very thin membrane that really doesn't serve any significant purpose. Truthfully. Right, truthfully. Sure. Right. Right, she's correct. She's right. Gymnastics, playing sports. Absolutely. Again, this is what so many people get focused on this hymen as being some sign of virginity or purity, but it's not. You know what I mean? Because you may not even have had a hymen to begin with. You with me? You may have been born with it already open. Does that make sense? Stay with me, CJ.
So wait, all of those are pictures of hymen?
Yes, of potentially what it could be. Absolutely. Again, so if you think of this as being all the way open, right? This would just be a partially. Yeah. There's a term for it, but I don't remember what it is, to be honest with you.
Wait, so you said if it's closed, then you go and cut it open?
Sure, right, because you need that to be open. You know, there are other fluids that come out, not even just the menstrual fluids, but there are other fluids on a continual basis that come out there. So yeah, they would open it.
So it never goes back to
Yeah, normal is this. I mean, for most adult women, that would be normal. Yeah. And again, there's no significant function that it's serving. It's not like protecting you from disease or something, because that's what the labia are for. It's interesting. Other questions? We're there? We're moving on? This is normally where I would have given you this piece, but I think we've talked a good amount about this slide already, about the analogies between the two. Shh. Please. All the way up here?
Yeah.
Well, no. This is the urethra. Right. That's the urethra. Yeah. Well. Truthfully. So right, Andrew, you're making a joke, but you're being truthful. So I'll put this one up. So there are times in the
That's all. Don't say it.
in this birthing process, again, you are taking a baby's head that is, let's say, 10, 11 centimeters in diameter, through this tube that's not that big, right? So it stretches. Thankfully, it stretches. But there are times when it does tear. It does. You can get tears usually. Stay with me, friends. Usually they'll come down. Not. I don't know if I can write on this or not. Usually it would come down this way, would be the tears. It can be even that they would cut this to allow it to stretch. Okay? But again, the point is you want to get the baby out. The baby can't stay there. Shh. So truthfully, they stitch it up and you'll be fine. Okay? It does take some time to heal, but it's not an uncommon thing to happen. Shh. I can't hear you. What? The hymen would be covering part of this, the actual opening of the vagina. But you would, before you were pregnant, in order to get pregnant, you have to have intercourse, which would take care of the hymen.
No, but I'm thinking if you have put in a tampon, then you must have had.
More than likely, you're correct. Yes, more than likely. If you've used a tampon, you have probably, that hymen is not present anymore. More than likely. Now again, tampons are not that large, so there might have just been through parts of it. But question?
Are we talking about pregnancy?
Yes.
Okay, we're okay.
We can talk about it briefly. Sure. We have 4 minutes left.
They, shh. Because normally when the baby comes out, the doctors will grab the head. That isn't that dangerous.
Well, they are more supporting. They're not yanking.
Okay.
So yeah, no, it's more the mother's contractions, this pushing of the muscles that are pushing the baby out. It's very much not a let me yank and pull.
Could you ever work out those muscles before you had a baby?
Absolutely.
How do you do that?
Sure. There's things called Kegel exercises, Kegel is the name of the doctor who first came up with these exercises. And it's controlling those pelvic floor muscles. Yeah. People who have incontinence problems, where they can't control the amount of urine or they leak, these exercises help with that. There's truthfully a whole branch of physical therapy that deals with that. Yeah. Sure. Shh. Yes. Absolutely. So, that's not always the case, but yes. With my wife, Alex was a much larger baby than my daughter was. So my wife worked for, I think, 20 some hours with Alex. It was a tough labor. But my daughter, I remember very clearly the doctor telling my wife, stop pushing, because she wasn't ready yet to catch Rebecca, which is basically almost what happened, because she was significantly smaller than Alex was. So yeah, after that many children, yes, things would be stretched out enough that it's still a significant stretch, but yeah, it would be an easier process, you would think. Come on, guys. Question?
I heard that if you have sex while you're pregnant, it makes it easier to have a baby.
I am not aware of having sex making it easier. No. Now hang on. You cannot do any significant damage. You cannot do any significant damage to the baby having sex while you're pregnant. It's two separate areas, right? The baby's in the uterus, the penis is in the vagina. Okay? I'm just telling you, you would not want to go. Right, it's not going to bother anything at all. Position-wise, for the woman, it becomes some difficulty because after a certain point, laying on their back is not very comfortable at all. Truthfully, the baby sits on that aortic, the abdominal aorta, and can cause some problems. No. I'm talking about way toward the end. Way toward the end. But, no. Yes. You cannot do any damage. And I don't know of anything saying that it makes it easier. Not that I'm aware of. All right, friends. Adios.